Swelling after breast implants, how long does it take to recover? How long does that swelling take to resolve? Well, the real issue, I think, is just going to be what does it take for the implant to settle and kind of get to your normal shape? What's going to seem like swelling at first is going to be a lot of the implant, especially with a little bit tighter skin envelope, is going to seem extremely high until the body and the breast tissue has had swelling resolve over that first week or so and had some of the breast tissue relax and accommodate and relax into a more natural shape. That's going to happen over several weeks, but even over several months, and it's going to continue really over years. But that initial shape often comes in over really 4 weeks, 8 weeks for a breast augmentation patient. It can be a bit longer if you have very tight tissues, and it can be a bit longer if we've done breast lift and we've really over-tightened the tissue, knowing that it's going to relax because of the need for the breast lift, and I've really pushed things up. That can be more along the lines of a few to several months. What problems or complications do we have after a breast implant? Well, having the shape settle in initially, it can take some work and time, and that's a normal part of the process. We want to avoid capsular contracture. We're taking all kinds of steps to do that, and so it's important to follow postoperative instructions and limiting activity in those first 6 weeks. But we can still, even doing everything right, still see capsular contracture. We do have that Aspen system ultrasound treatment that we like to integrate where possible for that. Other complications, whether it's temporary numbness or of the nipple area of the breast, very common. Even hypersensitivity, when a sensation comes back and it's too much, is also common. That's usually a temporary thing. And if it's too much, we can medicate to get that to calm down, and that works actually quite well. The incision often is stiff and can be thickened in some patients, but massaging that area, it's a normal area of healing, generally is going to be all that is necessary along with incision care for that. Bleeding, very uncommon. Usually you're going to know it. You either get some dark bruising or the breast blows up and it's got a lot of pain. Very uncommon, but if we see that, it definitely needs to be treated. So any questions, of course, we want you to contact us immediately on that. And then over time, there can be discomfort with the implant. You do have an implant. It's not uncommon that you'll feel it or get areas along the muscle border, somewhere along the breast. They can get some soreness, and we're generally going to be able to get that to resolve just treating the symptoms, whether it's changing position, muscle relaxer medication, or changing the bra, changing activity a little bit. We just want to work to know that, hey, it's not an uncommon thing. We're going to have some discomfort or at least notice the implant at some point. We want to work to identify what works for you to get that to go away, so that if you start to get a little bit of that in the future, that we can get to go away as quickly as possible. So healing from breast lift, there can be minor complications or basically like bumps in the road in that healing period. At first, the breast is going to typically seem tight and high, and you've got a lot of incisions potentially. Along those incisions, they're often ridged up and slightly irregular, and so it does take time for those to settle down. Sometimes some of those areas, particularly at junctions, can have a little bit of skin breakdown. We want to follow any of those and, of course, nurse those along. If there is drainage, anything along those lines, anything that seems abnormal, we're going to want to work with you to identify what's going on and work through any of those issues. Numbness is very common initially. It's basically expected. It can come back and be too sensitive for a bit. That's pretty common as well. That's usually also very time limited, temporary, and goes away. If it is a problem, we can give medication for that as well. So the main things are making sure we follow postoperative instructions, particularly with activity, good nutrition to make sure we've got plenty of resources for our body to heal, contacting us with any issues. And then over time, the implant does need to settle. We want to be in close contact to make sure we're doing all that's necessary to get the implant in the right position. Various amounts of massage and manipulation we're going to work with you on to get the ideal positioning and shape for the breast overall with the implant positioning. And then over time, the implant may be sore along the borders, or you at least may notice where the implant is and feel it in your body. We have an implant in the body. And at first, it may feel a little bit different to you to have it in the body, or you may notice a sore area. Not uncommon at all. And if we see that and it becomes uncomfortable, we're going to want to work with you, identify what is it that we can do to make those symptoms go away if they are uncomfortable, and make it more normal for you so that you know in the future things that you can do to make it more comfortable. Diet and activity after surgery are actually a really important part of the recovery. Diet, especially for sodium restriction. It's weird. I've had injuries where normally I actually have a reasonably high amount of salt in my diet. I'd like to reduce it, but I kind of love salt. When I've had injuries and I've had surgery, that same amount of salt in my diet, I blow up everywhere in my body, but especially where an injury has been in my body or where I've had surgery. That definitely happens. So for the breast especially, we're going to want to make sure that we limit sodium in our diet. And if we've done a bigger breast surgery, breast lift surgery, it's going to be important that we really maintain our nutrition, really keep up our protein intake so that our body has all of the resources it needs for the healing period. And then activity is critically important that we not overextend ourselves to increase our blood pressure and the chance of bleeding, and overuse our arms and our upper body for a full 6 weeks if we have an implant in place, so that we don't increase trauma in this area. I can't emphasize enough how many times a patient and I have had regret when I probably did a little too much. I didn't realize it. Maybe I did a little too much lifting or a little too much vacuuming because I felt pretty darn good. And they ended up with a capsular contracture we feel like was from a little bit of bleeding that was on the side that they did more, etc. So while it may not cause that, we don't want to look back with regret. It can lead to a very significant problem and even reoperation. So we take extensive steps during surgery to minimize everything we possibly can to decrease the chance of capsular contracture, but there's always a chance. Post-operatively, it's also critically important to follow those activity restrictions. And same thing with anything in your diet that can thin the blood. So we want to work very carefully with our nursing staff on the recommended medications to not take after surgery, especially blood thinners, aspirin, and other medications that can thin your blood, along with the activity that can boost your blood pressure up. Having a hematoma or bleeding after surgery can also require reoperation. When we do that for a hematoma or bleeding after surgery, that by itself is a significant additional risk factor for not a reoperation to remove the bleeding, but also a risk factor for that capsular contracture.